Right. Yes, indeed. So listen, you guys can write to us, send us your baby pictures from the past. We all took the same picture, didn't we? All of us went to the same. Was it Ramogi Studios? Where everyone looked like they were forced to leave their games. And you were dressed in your Sunday best and you were pushed out there. I'm going to share my baby. I only have one. Okay? I only have one picture. I'm going to share it. I want you guys to share all your old school photos with us. All you have to do is send those photos on our WhatsApp line. Everyone keeps asking, do you have a WhatsApp line? Yes, we do. 0712-932-012 is how you can do that. And we'll be happy, of course, to showcase your old you. For now, we love smiling, right? Yeah, everyone is smiling. Is everyone smiling? Yeah, I love to smile. One man who's transforming smiles from across this country. Doesn't matter where you're from. You could be from Lamu, you could be from Narok, you could be from anywhere. Doesn't matter. All you have to do is write to us, tell us your story, take a picture, send it, and Dr. Justin Mwendo and the Molars Dental Practice team will hook you up. We have him here today. Welcome him, everybody. Hi. We wanted you to dance. We had even prepared for you a song.
Oh,
yes,
really?
yeah,
Yes,
next time,
please.
yeah? Next time. How are you?
Fine, Kobe.
Good to have you.
Good.
How's it going?
Good morning.
Good morning. How are you?
Fine, Kobe. How are you?
Excellent. I'm very well, thank you.
Happy to be here.
Yes, next time we'll make you dance. We promise.
I'll try.
Okay. We're getting a lot of great feedback on this segment, and I believe it's because people just never knew it was possible. People have been living with crooked teeth, with oral issues, dental issues, and they thought that that's the way of life. How do you feel the segment is going, Dr. Mwendo?
I'm actually surprised. We've seen our emails are full.
Yeah.
We are going through them and we are getting back to each of them one by one. We will be seeing them here on this segment.
Okay.
Yeah.
Fantastic. But what it looks like is that actually people do have very different problems. With each candidate, it's a different problem. Age has also come through. I've had calls from moms. I've had calls about people's grandfathers and grandmothers who don't even have teeth. And they're like, Kobe, can my grandfather get teeth? You know, so speaking of age and the kind of dental issues people face from age to age, talk to me about that.
Kobe, what has come up is the neglect. I think there's a tendency to neglect your oral hygiene, oral nature. So what has come up is there's a lot of neglect, or should I say misinformation.
Okay.
So we actually have to now talk to each candidate one-on-one, get to inform them. Some of the things are pretty minor. Actually, they are sortable within minutes in the practice. Yeah.
Absolutely.
Yeah.
The issue, of course, of age specifically. You do deal with young children, and we talked about that last week. But you also deal with adults who have had these issues even from when they were small. Someone who's had issues from when they had their milk teeth, and they come to you as an adult. How do you treat that kind of case?
Well, we have a family dentistry whereby we deal with the whole population as it is.
Okay.
So we deal with the pediatrics, the youth, the geriatrics, all alike. Although there are some conditions whereby you find that we need we have a pediatric specialist in the practice. Yeah, myself, I prefer dealing with the cosmetic aspects.
Yes, that's the one we like, right?
Yes, yeah.
So one of your candidates is here. Her name is Anne Chesarem, and you've been her doctor, her dentist for a while. Anne, come up here, darling. How are you?
I'm good.
Good to have you.
Good to have you.
Excellent. Have a seat. You're a smiling patient. We love smiling patients. And tell me your story, your oral story growing up. What was it like?
Okay, I grew up those days when we have very few dentists around, and it was very difficult actually to get services to be served, and even giving priority issues that were not painful. I realized that most of the time I would put my hand on my mouth to cover my mouth. When I was growing up, friends would mock me, would ridicule me that my teeth were outside. And I used to be called funny names, like Wadog, a squirrel, you know.
Really?
So I grew up, my childhood was that difficult, whereby you didn't have that confidence when smiling, when talking. Yeah.
Did you ever think that there was a solution in sight, or did you feel as a young lady that this is something that you'd have to live with for the rest of your life?
It is very interesting because when you have teeth that are not aligned, it's not a priority because you're not sick.
Yeah.
You don't have any pain.
Yeah.
So it was like, I think I thought this is part of me. This is how I was made to look like. Yeah. So I didn't know there was a solution, honestly.
There is a solution.
Yes.
That's what we've been telling everyone on this show. There's a solution inside Dr. Mwendo. She represents many Kenyans. What can you say about the fact that, yeah, people are going around thinking that this is just their fate?
Well, people have accepted what they look like, okay? We find our clients who come and, well, they are coming for minor issues like fillings, and we tell them, hey, have you ever noticed your teeth are crooked? I'm like, really? Yeah, we give them a mirror, they are crooked.
Yeah.
Have you ever noticed your teeth are brown? Others don't even tell. They can't tell. They don't even know. Yeah.
Okay.
So it's the awareness level is there's need.
Yeah, there's need. But that's why we're doing this. That's why we're doing this on Better Living. We want to make sure that the information is disseminated properly. And the way we're doing it is by presenting cases that have been through these type of procedures. What was Anne's issue initially?
Well, she just had what we call a malocclusion, whereby we found that the jaws were not positioned properly with the rest of the head, the skeleton of the head. So now we are trying to take them back, and she's been a great patient.
Okay.
She's really compliant.
All right, so when you first heard about Molars dental practice, who told you, how did you figure out that there is a solution in sight?
Okay, thank God with availability of technology and availability of information. When I'm reading newspapers, when I'm watching the television, I got to hear that it can be solved.
Yeah.
So I saw that, and I happen to have known that Molars is doing that. I could not waste time. I could not hesitate.
Yeah.
I actually ran there severally, and I talked to the doctor, and he told me, even with your age, there's no problem.
Right.
We can sort it out.
Oh, I love
Yeah.
that. So age, yeah. And we're talking about age specifically today. Yes, there are a lot of people like Anne who feel, is it too late? What's the point? What can you say to those people?
Well, age, it matters, but it's not an exclusion. With age, it just lengthens the treatment time, but doesn't exclude you from having treatment.
Okay.
Yes.
All right. So the kind of procedure that Anne specifically needed and the amount of time that you have to spend with a patient such as her, give us those timelines.
Well, she will need to come for multiple appointments, possibly once per month, for around 1.5 years to 2 years for treatment.
And you're the second candidate we've seen with braces, and a lot of people feel that braces are painful, they change your life completely. How has this experience been for you?
To be very honest, it has been very smooth,
Okay.
very comfortable. Personally, when I started, I thought I was not going to eat normally, I was not going to talk normally, but surprisingly, I do everything normally.
Okay.
Yeah.
How long does she have to have the braces?
We are midway, around 6 months to go.
Okay. I don't know. Have you guys always felt like braces are for life, right? It seems like it's a commitment, like a couple of years, but for some people it differs, doesn't it?
It differs.
Okay,
yes.
tell us.
Well, as I said, it depends on what we are correcting first.
Okay.
The severity of the condition. Okay. Age is another factor. And then compliance of the patient. If you are able to come for your appointments as it should be, it's shorter. If you lengthen your appointments, well, the treatment also lengthens.
The treatment also lengthens. And we love the fact that you've come to share your story. What did your family think about this?
Oh, at first, they were like, will it succeed with your age? You know, most people actually kept on asking me, why are you doing things that are for children?
Yeah.
But I told them, wait and see.
Right.
You'll see the results. So after about 4 months, they could notice the difference.
Wow, really?
Most of them actually told me, is it you?
Yeah.
How comes within a short time there's a difference, there's a big difference? And then I was telling them, wait and see, we are not yet done with the treatment.
Yeah.
Yeah, so they were very happy.
Okay.
Especially my children, they were very happy.
Oh, we love it. Yeah, mommy's going to look fabulous. I'd be happy.
Well, you notice attitude is also another thing. Okay, well, I'll tell my patients, when you wear braces, wear them with an attitude.
Yeah.
Be proud of them, okay?
Because you're fixing it.
You're only younger today than you'll never be, isn't it?
Absolutely,
yeah.
absolutely. I will smile until I'm an old show forever. It doesn't matter how old you are, it doesn't matter about your past, but the fact is that it's fixable. And that's what people really need to know.
Yes.
All right. So you can be the next candidate, okay, on this beautiful smile segment. We want you guys to log on, tell us what your issues are. What I'm finding is people are telling us, but they're not showing us the picture. So there is that kind of embarrassing factor where people don't want to take a close-up picture. If you do, Dr. Mwendo will be able to tell you what he needs to do quicker. Cindy or Dr. Mwendo?
Yes, yes.
Yeah?
Yes.
Pictures are vital, aren't they?
Yes, they are.
Okay. Where are you located, sir?
We are at Electricity House on the 3rd floor,
Okay.
Along Harambee Avenue.
All right.
Yes.
What we'll do you one big favor. We're going to put their contact information on our social media platforms so that you guys can contact them and go and visit. We're picking at least 4 candidates a month, all right? Very, very simple, and it could be one of you. And it doesn't mean that you can only nominate yourself. Someone was asking me last week. No, you can also nominate your dad, your mom, your grandpa, your grandfather, anyone you know who needs it. Now, I'll tell you guys a story, and he's probably going to watch this show because he watches me. The guy who sells me my dresses, his name is Chalo. Chalo is amazing. I go there for one thing, I walk out for like 5 things. He's a great salesman. And I just was scared. I was actually just scared of, he's got completely brown teeth. I mean, completely. You can't even see any white at all. And when I met you and we started developing this segment, I was like, man, Chalo is the guy. He's hilarious. So I thought, wonderful, right? It's very hard to tell people. Don't you guys feel that? Even if it's your family member, it's very hard to tell someone, hey, by the way, nataka niku. Don't you find that, right? Because it's so, as you've said, some people don't even know they have it. So we need you to tell us, Dr. Mwendo, when we have friends and family members who need to be helped by your practice, what do we tell them?
Well, send them.
What's the language?
What you need to do, send them the number to us, and we'll call them and give them this
Alafu don't say I said.
I'll not say it.
All right, I'm going to hook you up with Chalo.
And
he's going to dress you as well. He can dress you, you won't believe, right?
Amazing.
And then, and also you nominate somebody, all right, so that they can go through the same experience.
Yes,
but we're going to be checking up on you, all right, down the line, just to see how everything is going, okay?
Yes.
But Dr. Mwendo, we just want to say thank you. This is amazing what you're doing, all right? And we're very grateful. Transforming smiles is a beautiful thing. You're changing people's lives.
It's my pleasure.
Thank you very much,
Thank you.
all right?